Hi, my name is Alex Lemery, and I'll be discussing my article that's titled Comparison of Constraint-Induced Movement Therapy versus Mirror Therapy Effect in Infarcted Cerebrovascular Patients for Improving Hand Function. So the focus of this study was on improving hand recovery after a stroke, which is very important because although many stroke survivors regain some ability to walk, only about 5 to 20% recover good function in their upper limbs, and this greatly affects daily tasks such as dressing, feeding, and grooming. The study compared two approaches, CIMT, constraint-induced movement therapy, or mirror therapy. CIMT is where the patient is required to use their weaker arm by restricting their stronger arm, and mirror therapy works by using a reflection on the unaffected hand to stimulate your brain. And both were delivered for 45 minutes a day, 5 days a week for 4 weeks. The patients, which were 26 stroke patients, were randomly assigned into one of the two therapies, and their progress was measured using the Fugl-Meyer assessment and the Chodok arm and hand activity inventory. These tools evaluate your motor function and control using real-world functional use of your upper extremity. Although both groups improved, the CIMT group consistently showed greater gains. At the end of the study, the Fugl-Meyer upper arm score averaged 29.46 in the CIMT group compared to the 27.7 average in the mirror therapy group. The wrist and hand scores showed a similar pattern, with the CIMT group averaging 27.46 and the mirror therapy group averaging 24.92. And the total upper extremity score demonstrated the largest difference, with the CIMT group reaching 56.92, while the mirror therapy group reached 52.69. And all of those differences between the two groups showed a statistically significant difference, enough so that CIMT showed a much greater and more effective improvement than mirror therapy. Their functional performance was measured by the Chodok assessment. This also favored the CIMT treatment, and by the end of the 4 weeks, CIMT participants averaged 71.77, while those in the mirror therapy averaged 68.3. And again, this is also a meaningful difference, so CIMT worked a lot better than the mirror therapy for these patients. And in conclusion, the study found that both therapies are effective for improving hand function after an infarcted stroke, but constraint-induced movement therapy produced stronger and more consistent improvements across all outcome measures. Mirror therapy still demonstrated benefits, but it may only be useful when CIMT is not feasible. But overall findings support CIMT as the more impactful option for restoring hand function after a stroke.